All right, now public sector unions are once again embarking on a strike over wages. On Tuesday, workers affiliated to COSATU, SAFTU and FEDUSA will embark on a shutdown, bringing services to a halt. Workers are rejecting government's 3% increase offer, and unions say their 6.5% compromise is now off the table. Let's discuss this further with Dr. Angelique Coetzee. She is with the Southern African Business Health Confederation Committee, just to tell us how they're being affected, or how rather, patients will be affected by this fight between government and the public service union. Thank you very much, Doc, for your time here on ENCA. Just firstly, should we be worried as customers that at some point we'll go to clinics and hospitals and not find anyone there to help us?
Good morning. Yes, it's a very valid question. And yes, to your second question as well, I think the patient should be worried going to especially clinics to get, especially around chronic medication services, the medication in a acute incident. When you are sick, want to visit the hospital. If the gates are closed or if people are being shown away, you might not be able to get medication or treatment for any acute condition that you might have. We also need to understand there's a lot of people that doesn't know about strikes. They still travel a long distance to get their chronic medication at hospitals at great cost to themselves, then ending up at closed doors or clinics that are shut down at the time that they are arriving there. So yes, it will have an impact. It will have an impact on the immediate treatment and care of any person. So that would be a problem. And then you will have a long-term care problems. What we have seen, if you don't get your chronic medication, we have now coming from the COVID pandemic, patients not well controlled on their blood pressure, whatever chronic conditions they had because they didn't have access.
I just imagine things like procedures, Doc. I wonder if it'll even get that far, because already we do know, especially in the public sector, how bad the backlog is there.
Yeah, there's a huge backlog. You are absolutely correct. And if you take 1 or 2 days off to strike, that might be a problem. Ambulance services, would that be there? Funeral, services, all of that might be implicated in this. We also know that, doctors are not supposed to go on strike. They are essential workers. We do know, however, that nurses, according to the Nursing Amendment Act in 1992, that they might be able, there is provision to strike if there are certain conditions. Normally they will strike during their tea break or during lunch hour, but it becomes extremely difficult if you are busy with a patient and now you need to stop because it's your lunch break. No one can take over, and you have to go on strike. So, ethically and morally, is it right? I don't think so.
South Africans and as patients, why the public service workers are embarking on the strike. They were, of course, disappointed after government reneged on the initial agreement of 3 years and the increase thereof. And, of course, after COVID-19, some of them passed away, and their families that, are complaining about the fact that there's not enough money, really, to sustain families, etc., because of what happened during COVID-19 and the fact that that also caused the government agreement to be backtracked on, right? But isn't there an oath that healthcare workers have taken, that you cannot just watch and let a patient suffer? Or should we really be expecting that they'd be that heartless?
No, they should not be that heartless. But now you also need to understand that there might be intimidation to doctors or nurses that want to work. We know, unfortunately, what happened during the strike. So you will get the people who would like to work, who's not interested in the strike. There might be violence against them. They might be intimidated. That also brings a problem. And yes, to have a 3% wage increase it is, coming out from a 2-year stint where we saw what COVID-19 did to the healthcare workers, doctors, nurses, all of them, the emotional impact, the burnout, all of that. And then to say 3%. So again, 3% on a blue-collar worker or on a person who doesn't get a high salary, it's not really going to add any value. It might add more value to your executive and mid-management. So, maybe they should also negotiate. If there is no money or there's not enough funds available, then rather than for those people who get not a high income, isn't there a better way to look after them, to try to help them? So it's there's two sides to the coin. But in the end of the day, ethically and morally, you have an obligation towards your patient.
Talking about negotiations, and very quickly, Doc, has there been a new offer by government? Have you heard anything about government bringing forward a new offer?
I haven't heard anything. And, looking at what we have seen now this past few months with strikes, I'm not of the opinion that they will get a 6 or a 10% increase. There is, unfortunately, also not enough money. But then look at your lower income brackets and try to help and assist those people.